Today I'm going to speak about a condition, medical condition, which is called as trigger finger. This is a very common condition which affects the fingers. Probably you had experienced when you bend your finger, if you have difficulty to straighten it up, it's called trigger finger. Of course, there are some stages. At the end of the last stage, sometimes some people have a situation like this. They flex their fingers, but they cannot dorsiflex. So, or they have a sensation, feeling, and even a sound like popping, catching here. It is called trigger finger. The most affected fingers are the first and the second thumb and the index finger. Of course, the other fingers are also affected, but the most affected ones are these two. What are the symptoms? As I mentioned, the symptoms are a pain over the palmar side and sometimes a catching or popping sensation, feeling. It's a troubling situation, even if it's small. What can you do? There are some recommendations. Of course, the surgical operation is the last resort. It's not the option coming to mind firstly. The first one is, of course, non-surgical ones, conservative ones, and what are recommended are to rest. Straighten the finger up and keep it in that position. So splinting, finger splints could be useful, especially at night. You flex your hand when you wake up. The mornings are the most frequent times of symptoms, because whole night you flex your finger, and when you wake up you cannot straighten it up. So night splints are a recommendation, are an option. What else? Of course, non-steroidal anti-inflammatory drugs are options, and other than that, steroid injections are options. American Orthopedic Surgeons Association recommends 2 injections. It's not a official recommendation, but in the notes you can read it. If you got a steroid injection and you still have the symptoms, then you could have a second injection. Even after that, you have the symptoms, so the surgical operation is the option in the face of you. The mechanic problem I will describe. There are muscles around forearm, on the palmar side of forearm, the flexor muscles. They originated from the forearm and through the whole forearm and palmar side of the hand to the fingers. They inserted into the fingers. So these tendons are inside a tunnel, which is called tendon sheath. Tendon sheaths are the tunnels keeping the tendons in a stable way, so that if we move our fingers, we cannot see any deformities inside our palmar side or any other part of our hand and forearm, because the the tendon sheaths are keeping the tendons inside them and move the fingers in a smooth way with a smoothly gliding pattern. So if a pulley gets inflamed and sometimes even the under around or around the sheath there is a nodule coming up, and if this nodule stucks under the pulley so that you flex your finger but you cannot extend it, that's because the nodule is stuck under the pulley, and moreover the pulley itself is inflamed, so the problem worsened. At the surgery, we, as I said before, it's an outpatient surgical operation with local anesthesia. The surgeon makes the incision and reaches the tendon sheath, and after reaching that, he or she, who is your surgeon, cuts the tendon sheath, and if there is a nodule, excise the nodule too, and after that probably cuts the A1 pulley and checks the movement, if the movement is obstacled or not. If there is no obstacle in the flexion movement, if it is a smooth movement, so the surgical operation is finished. Most people have relief after the surgical operation, and if I think you have questions in mind that whether there are complications about surgery. Yes, of course, at all surgeries you have complications like bleeding, infection, wound healing problems. As in this condition, there are these complications, probable complications as well. Other than that, specifically for this operation, there are some other complications. First one is inadequate release. After the operation, patient may say, still I have the popping, locking sensation. This means that the release is not enough. Probably another operation might be needed. The other complication is over-release. It means if the surgeon released more than needed, it leads a condition called bowstringing. The tendon, as I said before, we cannot see a tendon under the skin. It is stable within the tendon sheath, and we cannot see it. If we move our fingers in a smooth way, the tendons glide, we cannot see them. But if the release is more than needed, too much, we can see the tendon in a taut position and the finger shortened. This is called bowstringing. It means that there is a release made more than needed. So, my friends, today we talked about a common condition which can affect most people, which is called trigger finger. And by the way, I remembered, I forgot to tell, this condition affects mostly women and middle-aged women, I can say. From now on, you will see some operation images and video pictures. So if you are hesitated to look at them, or if you are afraid of them, please don't see them. Your video is stopped here, but if you wanna look at the videos, what the surgeries look like, about what surgeries look like, or if you are a resident, you may want to check it out. Thank you for listening.
Kapatın. Kapatın parmağı. Bir daha.
Koymuşmuş ha üstü de.
Kapat aç. Aç. Kapat. Aç.